Hi everyone, it's Nadine here again. We're going to look at module number 2 for pulmonary fibrosis management. So, once you've been diagnosed with PF, usually you're seen by a respirologist who will coordinate your medical management. But to start off, basically you have to know that there's no cure. That's why it's a chronic disease. So the treatments that are used for it basically help with symptoms and also can help slow the progression of it from getting worse. So treatment options can vary from person to person. Um, and it also depends on how bad your symptoms are. Some medications for IPF have mild side effects and some have really severe side effects, but there's 3 typical categories of medication. So there's antifibrotics, which helps slow it from getting any worse. Immunosuppressants can be used. This always depends on the type of pulmonary fibrosis you have. And then corticosteroids may be used if you have a flare-up of the PF. So let's look at antifibrotics first. So in Canada, we have got 2 available. First one is called Ofev, that's the brand name of it. Nintedanib. So it's a twice daily capsule. And so it's also called a tyrosine kinase inhibitor. So that's a fancy way of saying it basically blocks cell proteins that make the scar tissues. Okay. Some side effects, it can affect the liver. So you're expected to do blood work prior to starting the medication and then monthly for 3 months after starting. Some side effects are diarrhea, nausea, stomach pain, vomiting, liver problems, decreased appetite, headache, and weight loss. Okay, and then the second one available is called Isbriet. Other name is pirfenidone. It's also a tablet or capsule form. Um, it basically is usually prescribed as a tapering dose, so you start low and work your way up. It also can affect your liver enzymes, so requiring some regular blood work. And side effects for this one include skin problems, increased sensitivity to sunlight, again, low energy, heartburn or indigestion, lung infections, muscle pains, and weight loss. Immunosuppressants. So they're not recommended for the treatment of IPF except when there's an acute exacerbation or a flare-up. Um, they're commonly used for other forms of pulmonary fibrosis, but not idiopathic necessarily. If your pulmonary fibrosis is caused by an autoimmune disease, so rheumatoid arthritis, Sjogren's syndrome, or it's hypersensitive pneumonitis, you may take an immunosuppressant to reduce that inflammation that's happening in the lungs. Immunosuppressants obviously suppress your immune system when it's too active, and prednisone is the most common immunosuppressant used for pulmonary fibrosis. Other ones include Myfortic or Cellcept, Imuran, methotrexate, cyclophosphamide, cyclosporin, tacrolimus. If you're on these medications, basically use your common sense, wash your hands, stay away from those who are sick, make sure your vaccinations are up to date, because we know that you're not going to be working at a top functioning immune system. So if you are exposed to either viruses or bacteria, you're likely your body won't be able to fight them off. Other forms are oxygen or other treatment for pulmonary fibrosis would be oxygen therapy. And like I mentioned in module 1, with the scarring of the lungs and the inability or the thickening of those walls of the alveoli, oxygen becomes an issue to transfer into the blood. And so oxygen, as we know, is imperative for all the organs and processes in the body. The body can't store oxygen. It needs to be continually replaced. So if our body isn't able to take that oxygen we're breathing in and deliver it to the body, we can't function properly. Oxygen is not going to cure pulmonary fibrosis, and oxygen is not addictive. In order to get oxygen, you have to qualify for home oxygen in order for it to be covered. We often do this with a blood test or a walk test. So your oxygen level has to drop to a certain point before you're able to qualify for funding. Sometimes you may only need it for exertion, and when you're sitting quiet, your oxygen levels are fine. But as the disease progresses, oftentimes less activity requires the oxygen levels drop faster. If you've got chronic lacking of oxygen, there's a lot of symptoms that can come with that. So you might fatigue faster, especially with activity. You might have some memory issues, lack concentration because again, no oxygen's getting to the brain or less oxygen. You can have swelling in your legs, cyanosis of your fingertips, earlobes, or lips. So basically a bluish tinge to them. And then also long term, we can cause some aggravation of heart disease if the oxygen is constantly low. So by adding extra oxygen, we can increase your energy levels, your shortness of breath might improve, and hopefully quality of life and your sleep also improve with that. Another big treatment option that we focus on is pulmonary rehab. So this is basically an exercise class specifically made for people with pulmonary or lung diseases. And basically you go there to learn how to safely exercise, how to improve your quality of life, how to lessen your shortness of breath and increase your endurance. So exercise has been shown to be one of the best ways to slow down the progression of pulmonary fibrosis. So in the program, you do some exercise training, so aerobic, so cardio, getting the heart rate up. You do some resistance and strength training for muscles, and you do some stretching. You work on breathing exercises. You can learn how to deal with stress, anxiety, and depression that come along with this disease. You may also get some nutritional counseling and specific education about your disease, and then support from professionals, not only professionals, but other patients that may have pulmonary fibrosis, which can be invaluable. It can be offered in person, where you actually go in person and use the equipment available, or it can be self-directed at home virtually. Now that we've gone through a pandemic, we've learned to adapt, and people are able to do it from their home as well. Another option is lung transplant. So this is really a complex surgery, and it would replace one or both of the damaged lungs with a new healthy set. There's lots of strict criteria that has to be considered for a transplant, and this would obviously be done with a respirologist. You've got to be assessed by the respirologist to ensure that your body is physically capable of undergoing this major surgery. So this includes doing a number of medical tests and procedures. You also have to understand that there are risks. It's a complex surgery, and potential complications can arise from the surgery. So to be aware of what those are. And the other important thing is you have to be committed and have somebody to support you along the process, because it is exactly that. It's a process. And often the person going through the transplant, you can't do it alone. You need help. Um, so there's different criteria like your age, other comorbidities or other diseases that you may have, um, such as cancer, um, smoking status, chest wall deformities, obesity, certain things like that. They may be contraindications for the surgery and basically exclude you from the opportunity. So there are not everybody can have a lung transplant. There are certain people that it's not recommended for. But that's always something to talk to your respirologist about. So self-management. So we've got lots of medical treatments, but self-management. How can we deal with our disease at home in a safe way and still have a good quality of life? And so there's a couple of really easy tricks or things that you've learned along the way to make your life easier. So one of them, or the number one thing I should say, is to pace and prioritize your activities. As the disease progresses, you will get more short of breath. So you've got to learn to pace yourself. Otherwise, if you go as hard as you can, you will end up in trouble, and potentially in a major acute distress. So by pacing yourself, you're kind of keeping things even keeled and managing it, keeping things under control. And then prioritizing what needs to get done and what can wait, because you will not be able to do what you used to do. So getting that in that mindset is often a struggle for people. And if you feel that way, you're not alone. It's frustrating. It can be depressing, but learning that, I'm going to do what I can. I'm going to break things up day by day. I'm only going to clean a room at a time. I'm going to sit down in between to give myself a break. Those are all things that you will learn with time that you have to do. Otherwise, you won't ever feel good. Modifying your activities is another big thing. So if you're going in the shower, get a seat so that you can sit down so you don't get so short of breath, because we know using your hands up, bringing your hands up to wash your hair, that requires a lot of oxygen, and people get very short of breath doing that. So at least being able to sit down while doing that is safer for you. It eliminates the risk of a fall and allows you to kind of, again, pace yourself. Sitting when you're prepping meals, when you're cutting, when you're cooking, applying for a parking permit so that you can park closer to the stores and not have to walk necessarily as far. Using helpful tools that make life easier. So a shoehorn, like the bath seat, like we said, grab bars in the bathroom to help bring yourself up, a raised toilet seat. All those things will help and just make it safer for you at home. Another big thing is the breathing techniques. So relaxation and self-management techniques. So you'll see I have the picture of the pursed lip breathing there. And that's the simplest thing you can do for yourself at any point when you feel short of breath, taking that breath in through the nose and then exhaling through pursed lips all the way out. And that breath out should be at least twice as long as it took to take the breath in. And repeating that basically until you get your breathing back on track is such a valuable tool in your toolbox that you can use. The more that you do that, the easier it will become, and it will become almost second nature, where you won't even realize that you're doing it. It just is naturally to breathe like that. Also, just even taking deep breaths, stretching out our lungs, because we know we get lazy and we start to breathe very shallow, especially when we have got pulmonary fibrosis. We know our lung capacity is smaller. So, filling up our lungs, stretching them out, opening up those alveoli is super important, because otherwise, again, they start to kind of collapse in on themselves, and then we don't get the use of them that we should. Other things include meditating or visualization. If you're an anxious person, find a way to kind of cope through those panic attacks, because it is a scary thing when you can't breathe. And then lastly, which we'll talk about in a lot more detail, is learning how to manage acute exacerbations or flare-ups with the use of your pulmonary fibrosis action plan. And we'll talk about that in future modules. Huge thing, huge important thing. If you are a smoker, one of the most important things you can do is to quit smoking. So again, there's lots of options for you. Speak with your respiratory therapist or your doctor, nurse practitioner, anybody. There's programs everywhere available. Having an appointment with a smoking cessation counselor can be helpful to pick a route that might be the best route for you to try. There's the patches, the short-acting nicotine replacement, including gum, lozenges, inhalers, and then there's pharmacological options like Zyban or Champix. Um, you know, there's always help for you, so please reach out, because we do not want lack of access to these programs to be a barrier for you to quit smoking. So that's basically a quick overview of all the different things that encompass treatment once you've been diagnosed with pulmonary fibrosis. And like I said, in the future modules, we'll go into a little more detail on what those action plans look like. So stay tuned for those. Thanks.